All right. Hello, everyone. Welcome back. My name's Kate Marquis, one of the nurses at the UVA Life Support Learning Center. We're looking at part 2 of our sensory assessment series today. We're doing sound, everything that we can hear when we're working with our patients. This will work for whether you're a nurse, a tech, an EMT, a medic, a physician, what have you. This is built for you guys here today. All right, so we're going to talk about our objectives here. 2 ways each of the following senses can influence the assessment of a patient. This one is sound. The link for our site one, which was our previous video here, it should be in the description below. So talking about the why, we talked about this last time, but I will mention it again. We can gather so much information by utilizing our senses, right? And a lot of times this will give us a clue to whether or not the patient is in trouble or how quickly I really need to go in and work with this patient just by using our senses here, right? Vital signs are great. I love numbers. I'm for numbers, but they only give you so much information, and equipment can fail and can be wrong. We talked about the toothbrush VFib, where someone's brushing their teeth, it looks like VFib on the monitor, or that pulse ox that's just sitting on the bed still reading 99%, or even that blood pressure cuff that's now been attached to the bed railing or the stretcher railing there, and it's reading, kind of a wonky number. It's usually like 60/30 or something like that. So vital signs, while they're fantastic, we can have equipment failure associated with them, and they are just points on a graph, so they may not necessarily be reflective of where the patient is until we kind of figure out what that trend is. So talking about sound, I can hear things at a distance, so it can start giving me clues about my patient's condition before I even happen upon them and lay hands on them. So let's talk about some of the insights that we can get just from what we hear. Talking about airway and breathing, kind of lump those two together in some ways. For airway, you can hear if there's an obstruction, so I'm listening for stridorous sounds. While breathing, I'm looking for other adventitious breath sounds. The big one that kind of comes to mind right off the bat is wheezing. So when I'm looking at that, there are different levels of adventitious breath sounds, things that might not necessarily be in your EMT textbook or your nursing textbook or your medical student textbook, different levels. The first one is I can hear some sort of adventitious breath sound with my stethoscope, right? That's pretty standard, you think about it, right? So I need to use my stethoscope and I can hear the lung sounds and I hear wheezing. Cool. The next level is I'm standing next to them without my stethoscope on and I can hear them wheezing. Okay, now I'm a little bit more worried because they're obviously wheezing. But that's not quite as bad as I'm approaching them and I'm standing in the doorway, whether that's the doorway of their room or doorway of the house or what have you, and I can hear them wheezing. Okay, so that is a more profound wheezing. I'm quite a bit more worried now. And then the ultimate level is from the hallway, down the road, what have you. And that is probably one of the worst off. So if you can hear these different levels depending on how close you are to the patient, how bad off they are. So, being able to hear that does give you an advantage of what do I need to bring into the room. So we're kind of always thinking that one step ahead. So I can hear wheezing. Do I have my albuterol treatment or what have you? Do I have my corticosteroid because this patient may need corticosteroids or what have you? By having what you need with you and anticipating what you could need is certainly helpful. And when adventitious breath sounds get that loud, it's certainly good to be able to anticipate so that you can work quickly when you do get to your patient. Additionally, in talking about breathing, we like to talk about how many words are in a sentence. It's kind of a weird thing to think about, right? Why am I counting how many words they're speaking to me in? Well, it's a little different if someone's talking to you in full sentences and, breathing at a normal rate than talking in 4-word sentences or 3-word sentences or even 2 or 1-word sentences before they actually need to go and take a breath. So again, how quickly do I need to work with this patient? How quickly do I need to move? Of course, always safely. But it kind of tells you where the patient is with their condition prior to you putting on that pulse oximeter, putting on that waveform capnography. Moving on to neuro, things we like to talk about, speech. So I can hear them talking. Are they slurring their words? Is that normal for them? Do they have some sort of alcohol or some sort of drug on board, or maybe they're having a stroke? These are all things that I kind of need to keep in the back of my head. Are they using the correct words? Okay, do their sentences make sense? Or are they saying kind of nonsense like applesauce, tabletop, video game, keys? And you can see that they're trying to get words out and their meaning is not coming across. Or are they not saying words at all and it's just gibberish and nonsense, even completely aphasic? So these are all things that we kind of want to think about and think about whether or not that's new, whether or not this is an expected finding for our patient, especially as we move into mentation as well, as these could all kind of give us a sign that maybe this patient is having a stroke or maybe they're having some sort of hypoglycemic event or the like. So talking about mentation there, are they responding when I walk into the room? Are they looking at me? When I'm talking to them, are they looking at me? Are they responding back? These are all things that we can kind of keep in the back of our head when we're talking about altered mental status. So that was sound. I have 2 more lectures coming to you guys. We're going to talk next time about touch, and then we will finish off the series with smell. Thank you for joining me today, and I hope you'll join me again soon.